The first time that I realised that maybe this wasn't the full stop at the end of my running career was when I had a consultation with Mr. Kerry Acton at the Royal Surrey County Hospital. I sat there understanding that I was going to probably need a hip replacement, but Mr. Acton quite clearly asked me what I wanted to do. I said, well, I'd like to get back to some multi-sport. And Mr. Acton said, yeah, we can do that.
He was a typical example of somebody who years ago would have been told to reduce his activity levels, to swim and maybe do a little bit of cycling and give up running, and to wait until he was in his 60s or 70s to have a joint replacement.
I remember the relief of actually feeling as though I'm not in pain anymore.
I had at my disposal the technology that enabled him to return to his activity levels.
The new hip has completely changed my life for the better. It's allowed me to be competitive within my age group, not just giving me my life back, but it's given me a new, improved me.
I normally ask my patients to weight bear as they feel able, and most people by 2 to 3 weeks after surgery are off their crutches and walking around as normal. He rather surprised me by emailing me 13 weeks after his surgery to tell me he had just won outright a triathlon, but he'd clearly been training quite a lot before then.
I think the research that JRI are putting into new hip implants, the ceramic on ceramic, I think is admirable. You know, for a British company to actually be doing that, and for me as a Great Britain competitor to be utilising a GB-made product, for me is fantastic.
JRI are an example of fine British technology, but also innovating in a responsible manner. Another benefit from my point of view is that I'm spending large sums of insurance companies and NHS money on implants, and I'd rather that money went to a British company, British jobs and British technology and innovation.